Good afternoon, everyone. Thank you again to all of you watching at home for joining us for this daily briefing. I will start, as I always do, with an update on some of the key statistics in relation to COVID-19 in Scotland. As at 9 o'clock this morning, I can report that there have been 7,409 positive cases confirmed, which is an increase of 307 on the numbers reported yesterday. A total of 1,799 patients are currently in hospitals across the country with either confirmed or suspected COVID-19. That is the same as the number yesterday, although I would point out that that is not necessarily the same patients. A total of 189 people last night were in intensive care with confirmed or suspected COVID-19, and that is a decrease of 7 on yesterday's figure. However, in the last 24 hours, I'm afraid that 58 deaths have been registered of patients who had been confirmed as testing positive for COVID-19. That takes the total number of deaths in Scotland under that measurement to 837. As I have said before, and as I know all of us have in our minds at these moments, it's important that we never ever lose sight of the human reality behind these statistics. Each and every death represents an individual, somebody who is right now being mourned by the people they have left behind. And so, once again, I want to extend my deepest condolences to everyone who has lost a loved one. And I know we all think about them at these times. I also want to express my thanks, as I always do, because it's important that we always do this, to all health and care workers across the country. You are doing a quite extraordinary job, and you are doing it in the most difficult circumstances imaginable. And I hope that last night's applause showed you once again, in a small but important way, the deep gratitude that all of us feel for the work that you're doing right now. Now, there's a couple of issues that I want to cover today before handing over to the Chief Medical Officer and the Cabinet Secretary and then taking questions. As you know, COBRA met yesterday afternoon. Following that meeting, all 4 of the governments across the UK agreed to extend the current lockdown rules for at least 3 more weeks. Here in Scotland, of course, that decision is based on the advice of the Chief Medical Officer and our scientific advisory group. And they have advised me and the government that the lockdown restrictions have resulted in a slowing down of the rate of community transmission of the virus. That is positive news. And while we can't be complacent and should never be complacent when dealing with this virus, that slowdown seems to be reflected in a stabilisation of the numbers being admitted to hospital and intensive care. And again, I think we can see that in the figures I've reported to you today. In short, we believe that these restrictions are working, and I therefore again want to thank every single one of you for complying with these rules and for the sacrifices you're making in doing so. However, despite these positive signs, and they are positive signs, we are not yet confident that transmission has slowed sufficiently to allow us to ease up in any way on these restrictions. The advice to us is very clear that lifting the restrictions now could risk an immediate and a potentially exponential resurgence of the virus. That would very quickly, if it happened, result in our NHS being overwhelmed. It could lead also to many more outbreaks in our care homes, and it would almost certainly lead to much more loss of life. It could also necessitate the introduction of even stronger restrictions in future, with substantially more damage to the economy as a result. So in short, if we were to lift these restrictions now, or if we lift them at any time prematurely, all of the progress that we've achieved together in the past few weeks would be lost. We can't take that risk, and I hope you agree that we simply can't take that risk, because the price of it in human life and human suffering is not one that any of us should or would be willing to pay. That said, I know and am acutely aware that people also want an idea of what might lie beyond the next 3-week period. And while the burden of this work falls rightly on government, we do not, and I've said this repeatedly, we do not have a monopoly of wisdom. And that is one reason why, as we think through these decisions, I want to be as open and transparent as possible. So over the next week, we will begin to set out the work we are doing to try to plot a way forward. Let me be clear that this won't give definitive answers yet because no government has those definitive answers, but it will set out the factors that we must consider, the process for assessing the different options, and the framework through which we will reach these decisions in due course. And I want to emphasise one key point that will underpin these considerations, and it's not an easy point to make. This virus is not going to simply or magically disappear. While, of course, we hope that scientific advances, ultimately, of course, a vaccine, will offer some solutions, we are going to, in the meantime, have to get used to the fact that this virus will be with us for some considerable time to come. So the challenge we face, it's not an easy one, but it is an important one, is to find a balance that allows us to control and suppress the virus and minimise absolutely the damage that it can do, while also allowing life to go on, if not completely as normal, then at least in as normal a way as is possible. Because while we know that the current lockdown measures are essential, and they are really essential, we also know that they bring serious consequences of their own. And these are consequences that may also be measured in lives lost and life chances curtailed. So this is an important balance for us to seek to strike. That work is underway, and I will provide as much detail as I can on that in the days ahead. And I want to stress again to you today that the government will be as open as we can be. To be blunt, I will treat you, the public, as the grown-ups that you are, and try to share on an ongoing basis the really difficult judgments and balances that we're going to have to strike in the weeks and months to come. I want the public at large to be as involved in that as it is possible. Now, the other issue I want to talk briefly about is our response to the economic impact of this virus. This morning, as I do every Friday morning, I chaired the Cabinet Subcommittee on the Economy. One of the topics under discussion was support for businesses, and there are 3 specific and brief updates I want to provide on that today. On Wednesday, the Finance Secretary announced an expansion of our business support scheme. It means that in total, alongside other forms of assistance, we're now making £1.3 billion available in grants and support to businesses. Today, I can confirm that from that total package of support, more than 18,000 of these grants have already been awarded. That means a total of more than £215 million has been paid out so far. And we're continuing to work with local authorities to ensure that businesses can access the rest of that support as quickly as possible. The second update is about support for our seafood sector. It's clear that the market for fish and shellfish has effectively collapsed, and that is having a very serious and immediate impact on many of our coastal and island communities. The government is already providing a range of support for the seafood, aquaculture and fishing industries, and that includes help for businesses with smaller vessels. But today I can announce that we're allocating a further £3.5 million of support for fishing vessels of over 12 metres. And that means in total more than 1,000 businesses will now be eligible for support, and it brings our overall package of support for the seafood, fishing and aquaculture sectors to nearly £23 million. Providing that kind of emergency support is essential because it helps to deal with the immediate impact that this virus is having on the economy. But for the government, it's also important, as we do with managing the virus, that we also seek now to take a longer term view. Which brings me to the final economic point I want to touch on today. We're already thinking about how we will start to rebuild the economy once the immediate intensity of this crisis starts to recede. Now, none of us should be under any illusions about the scale of that task. This is an unprecedented situation. You've heard me and others say that many times before. And as I've said already, no government anywhere has all of the immediate answers. But we do want to start the work now to make sure that we are able to navigate the best way possible forward. That's why we're announcing today the establishment of an economic recovery advisory group. Its role will be to advise government on actions to support economic recovery. And crucially, it will consider how these actions can contribute to our aim of building a fairer and a greener and a more equal society as well. This group will bring together business leaders and economic experts, and the Economy Secretary will set out more details of it next week. But I do believe its establishment will be an important step in preparing Scotland for some of the challenges that lie ahead. So to close today, I want to reiterate once again the public health rules. I know you've heard me say these words many, many times before, but they remain as important as ever. You should be staying at home Other than for a very few specific reasons, exercise or buying essential goods, you should not be going out. You should stay 2 metres apart from other people when you do go out. You shouldn't meet up with people from other households. And if you or other people in your household show signs of COVID-19, you should be completely isolating. You should not be going out at all, even for essential purposes. Now, as I also always say, I know how difficult these restrictions are, and I know that they always get much tougher, and I'm sure feel much tougher at weekends, particularly for those of you with children. But they are essential. As I said earlier, we have a long way to go, but we are beginning to see signs that the lockdown is working. The first signs of hope are already there. So it is vital that we continue to follow these rules so that we don't go backwards and instead keep moving forward in the right direction. By all of us doing that, we're helping, as we are already seeing, slow down the spread of the virus. We are undoubtedly helping to protect our NHS. We see that in the stabilisation of numbers in hospital and intensive care. And while we are still sadly reporting many deaths every day, complying with these measures is undoubtedly helping to save lives. And we bring ourselves, by complying with these measures, every day we do it, a little bit closer to the time when we can start to return to some semblance of normality. So let me end by thanking you all once again for doing the right things. I hope in these difficult circumstances you will have the best weekend possible. I'm going to hand over now to Dr. Gregor Smith, who will say a few words, and then to the Health Secretary before opening to questions from journalists. Gregor.
Thank you, First Minister. I want to take you through some of the reasons why it's so important that we continue to bear the burden that these restrictions bring just now. The decision to extend these measures that affect our everyday lives so clearly hasn't been taken lightly, but I believe it's the right decision for this moment in time. We continue to be guided by the evidence when we take these decisions, and I'm very grateful to the group of scientists who continue to assist us and have provided the insights to the data and the evidence to allow us to come to these difficult decisions that we've made. This is a nasty little virus, and it spreads easily and preys on those who are especially vulnerable within our society. We need to remember that at this moment in time, as a race, we've never encountered this virus before. And for that reason, our immune systems are very vulnerable to it. We don't have any reliable treatment at this point in time, and at the moment we don't have a vaccine. But I'm confident that over time we'll develop these approaches. Before we introduced the series of measures to limit its spread and protect the most vulnerable, the reproduction rate of the virus sat at over 3. What this means is that for every person who caught the virus, they spread it to at least 3 others. So one case became 3 cases, and each of those 3 people spread it to another 3 people to make 9 cases. And each of those 9 cases spread it, well, you get the picture. Now, the actions you've taken have managed to reduce the rate of reproduction by 2/3. The reproduction rate is now calculated to be under 1. What this means is that the virus has not gone away, but it's spreading much less readily than it was before. So one person is likely, on average, to spread it to less than 1 more person. And that new case will, on average, again spread it to only 1 more person. It still has the ability to spread, but not in the exponential way that we have all feared and seen in the early stages. We see this already in the number of new cases that we report each day. There's been a slowing of the rate of increase here and also in hospital admissions. The doubling time for new cases has now stretched to over 11 days from a situation where it was 4 to 5 days only 3 weeks ago. Because of the nature of the disease and the way it progresses, it's too early to see this change coming through in the number of deaths that we sadly report. But I'm confident that this will happen soon too. But the margins are very small. In fact, they're tiny. And that's why it's not yet time to lift these restrictions. Because even a small drop in the way that you're making these restrictions work, at this stage will see us return to the exponential growth that will swamp our NHS and potentially lead to many more lives being lost. So I ask for your patience and your perseverance in making this continue to work. To stay at home for all but essential reasons, to ensure that you continue to wash your hands regularly, to make sure that you isolate if you develop symptoms, and avoiding contact with those that are most vulnerable. I was sent a message by a friend yesterday, and it summed up the situation we're in quite nicely, I thought. They likened it to having jumped out of a plane with a parachute, and experiencing that sense of relief that the parachute had opened and was slowing you down. But you wouldn't take the parachute off before you'd landed safely. That's where we are just now. We should be encouraged that the signs are going in the right direction, but we shouldn't yet take our parachute off until we've landed back on firmer ground. We're grateful to everyone for heeding our Stay Home, Save Lives message. However, I want to emphasise again that the NHS remains open. One important aspect of this that must continue is that of a routine vaccination programme. It remains an important way to protect you and your family's health. Receiving a scheduled vaccination, such as our childhood programmes, is one of the important medical reasons for which you should leave your house, and it will help protect you or your child from other types of serious illness. So thank you for your continued efforts. Please remember that by sticking with these restrictions, you're helping my colleagues across health and social care, and you're literally saving lives. Please stay home, wash your hands regularly, and isolate yourself if you begin to develop any symptoms.
Thank you, Gregor. I'll hand over to the Cabinet Secretary.
Thank you. I have said before, here and in other occasions, that the people who live in our care homes and the staff who work there are as important as anyone else. Across Scotland, our care homes and the staff in them provide persistent, compassionate care to the residents for whom care home is their home. But we know from our work with Scottish Care and from the data that we see that we need to provide more support to our care home sector in order to ensure that we can reduce the transmission of the virus for those residents and help the staff. So I want to outline today four key areas where we are now from today undertaking additional work. The first of those is in terms of providing additional clinical leadership to the care home sector. And today I formally asked our NHS Directors of Public Health to take on that local leadership role to ensure that we can work with colleagues in primary care who already work with care homes to ensure that they are providing all the clinical and medical care and support that is needed to those care homes, working also with partners across the third sector and our local authorities. To equip our care homes, making sure that they continue to have the PPE they need directly from us, where that adds to their local supply. And from this weekend, that PPE delivered directly from our national stockpile will be delivered direct to each care home. Ensuring that staff in care homes have the confidence that they need to use the PPE that is supplied and feel that they have had all the training and support that would help them to do that. And finally, the increase in testing that we announced in terms of symptomatic residents in care homes and ensuring that care home staff or their family member, if they are at home because of that household isolation, can access that testing clearly and swiftly in order that where it is appropriate, they can return to work, as I know so many of them want to do. Thirdly, making sure that the guidance that was issued in mid-March that ended communal gathering inside care homes in order to protect residents and ensure that we could minimise the transmission risk of the virus, that guidance is being followed in every care home, and that where there are particular problems around doing that, perhaps in the case of residents who have severe dementia, that we can provide additional guidance and support to them in doing that. And finally, in assurance, with the data that we will collect in that level of detail, the enhanced role of the Care Inspectorate and the inspections that they will undertake in care homes to make sure that they have all the support that they need to do the work that they need to do. We've worked through all of this very quickly with Scottish Care, with the BMA, the Royal College of Nursing, and again this morning I spoke to Unison. I'm very grateful to all of them for the work that they have undertaken. They will continue to do that work over the weekend, particularly to look at how we can maximise the opportunity of the now over 20,000 NHS professionals who are returning to work for the health service, the midwife and student nurses who have come forward, the paramedics who've come forward, the medical students who've come forward to ensure that we can enhance the community protection that is there, the clinical and other support to our care homes. So we take that whole system approach, which is a unique hallmark of our work here in Scotland and one that we need to enhance and protect.
Thank you, Cabinet Secretary. I'm going to move now straight into questions from journalists. First is Fiona Walker from the BBC.
Hello, First Minister. I noticed there's a proportion of the numbers who test positive has not flattened. In fact, it's increasingly gone up slightly. What does that tell us about where we are, considering the numbers seeking hospital treatment in an ITU are stabilised?
Okay, I'm not sure that figure is the one that is the most important in judging the community transmission, but I'll hand over to Gregor, who might be able to offer a bit more expert insight into that.
So we're looking at a number of parameters when we look at the number of people who test positive, and some of that is just the raw figures in terms of how many people are testing positive on a daily basis, but also the proportion of those that test positive as well. And I'm not sure that I would agree with you that it has remained flat and is increasing. In fact, over the last few days, that there has been a slight fall in that. I would urge caution. I wouldn't read too much into that figure at this point in time. It's far too early to kind of correlate that level of data with any marked response across the system. But as I said when I spoke earlier, I'm encouraged certainly by the signs of the data that's coming through at this stage.
I think two points would be, firstly, that we always have to take care to against reading too much into daily fluctuations and look at the trend. I've stood here in previous days and said don't read too much into ICU figures that are stabilising or going down by 1 or 2. But what we see there now is what looks to me more like a sustained picture of ICU and hospital cases not going up in the dramatic way that we might have expected if the transmission had been faster than we believe it is now. But in all of this, I want to just be very clear that we should all guard against complacency. We think it's positive that these measures are working, but the most important thing is we keep doing what we're doing, because it would be very, very easy for that to start going in the wrong direction again, which is why we need to keep focused on abiding by and complying with the rules. Ali Fortescue from Sky News.
Good afternoon, First Minister. Last night, the Scottish Police Federation said that the new PPE wouldn't provide any meaningful protection. Are you comfortable with those officers and other frontline staff doing their jobs in a mask that doesn't offer full protection?
I know that Police Scotland have confirmed that they have a current supply of relevant PPE for officers who are dealing with COVID-19 cases. The police have said that the use of type 2 fluid-resistant surgical masks is based on scientific evidence from HPS and others, and they're working with suppliers and the cross-sector PPE working group that we have to ensure that they have a continued supply of that. So we work closely with not just health and care, although primarily with health and care, but with other parts of the public sector to make sure that we have the right supplies, but also that the quality of what is being used is sufficient. And we'll continue to listen to and try to respond to any concerns that are being raised by staff groups, and in this case, obviously, by the Scottish Police Federation. Can I go now to Peter McMahon from ITV Border?
First Minister, good afternoon. First Minister, today I've spoken to Alistair Jack, Dumfries and Galloway MP and the Secretary of State for Scotland, and specifically about looking ahead to an exit strategy. Now, he told me that he respects the devolution settlement and you have powers, if you want to do things differently. But he said this, he said the virus does not respect borders, the economy does not respect borders. So doesn't he have a point in suggesting that Scotland and the UK should be in lockstep when it comes to the exit from the lockdown?
Yeah, he has a point, and I think if anybody had been listening, which I'm sure you have been, Peter, to what I've been saying in the last few weeks carefully, they would probably hear me saying something that is not dissimilar, but I'll go on and make an extension to the point, which I think is equally obvious. I did a radio interview this morning, and it's not the first time I've said this, but I said it this morning on several occasions that this virus doesn't respect borders or boundaries. I mean, that is obvious. One of the things I said this morning, which I believe is the case, is that we actually really need to see more of a globally coordinated response to this for that very reason. And that is why I have been, and the Scottish Government has been working so carefully and collaboratively and closely to align our thinking and our decisions with the UK Government, with the Welsh Government, with the Northern Ireland Government, just to make that point that we have to act in a coordinated way to try to give us individually and collectively the best way of suppressing this virus. So, I've never hesitated to say that, and that has really driven much of how leading the Scottish Government, have tried to respond to this. But the extension to that point, I think, is equally obvious. If the evidence and the science tells us that because we are all at perhaps different stages of the infection curve, we might need to do things slightly differently, I think it would be astounding for any First Minister to say that they would simply ignore that and not respond properly to that. So there have been occasions in this path so far, that while we're taking a UK-wide approach, my judgment, applying my judgment to the evidence and the advice I have, which is the job of a political leader, we've done some things slightly differently. We decided to ban mass gatherings a bit earlier. We announced the closure of schools slightly earlier. The lockdown, when it came in the UK, it came at the same time in the UK, but Scotland was slightly earlier in the infection curve at that point, so the lockdown for Scotland was a bit earlier. And we've taken a slightly tougher approach on business close down, construction being an example of that. So I don't think these two things are inconsistent. I think it is absolutely right that we have as coordinated a position as possible across the UK and hopefully across Europe and the world. But where the evidence with judgment applied to it drives us in slightly different directions, as long as that's for a good, sound reason and not for some silly political consideration that has no place in these kind of discussions, then I think that is pretty logical and sensible as well. So that's how I'll try to do this. It's how I've tried to do it from day one, and I'll continue to try to do it. My only interest here, and literally my only interest, is in doing everything I can, advised by the best people I can get to advise me the right things to try to slow down this virus and protect our NHS and to save lives. That is, what I get up every morning right now, trying to make sure we make the decisions to support all of those at the front line to try to do that. And that will continue to be the case for however long this crisis lasts. Peter Smith, My TV News.
Thank you, First Minister. We have seen exclusive site ITV News today of a survey of almost 1,000 people working in the social care sector in Scotland. It's showing us that 4 in every 5 carers say that their mental health has been damaged by their work at the moment. They're seeing people dying and they're worried about whether they've been responsible partly in carrying it into their homes and giving it to people they care for. The same number said they haven't been offered support for their mental health. 3 in every 5 say they are still stressed about the lack of protective equipment, and 3/4 of Scotland's carers say they fear for their own safety going to work. There has been a lot of focus on physical protection, the protective equipment, but what is your government doing to support these people, these carers, in their mental health going forward? It seems that morale is really low and there's been a lot of damage done to mental health.
I'm going to hand over to the Health Secretary, because we are looking very hard at how we provide on an ongoing basis mental health support to health and care workers. Can I say just generally, though, I've not seen the survey, but nothing you've read out to me there surprises me. Our care workers and our health care workers are dealing right now with the most stressful, difficult, challenging circumstances imaginable. They are, and I've said before, but so many of us could say the same thing. My own sister works in the front line of the health service. I see, therefore, personally and directly, the toll it takes of being in an environment like that with people ill with this virus, with knowing that people are dying of this virus. I cannot, in many ways, begin to imagine how difficult that is, and that has a toll on mental health that will not simply go away when the intensity of this crisis starts to recede. So we have a duty. We've got a duty now to do everything we can on a day-to-day basis to get the physical protection to workers, and we we'll never let up on that, but we will have a longer-term duty to make sure the support and the care and the mental health support in particular is there for people who have done so much to help steer us through this on the front line. So that's what one of the many things the Health Secretary is focusing on, and I'll ask her to give a bit more detail about that.
Thanks very much, and you're absolutely right. This is a really important issue, and in some ways, how this situation affects staff in health or social care, depending on which part they work in, whether it is NHS 24 and you're listening to some of the distress from people on a phone line, or whether it is a social care worker who has come to know the individuals that they work with every day very well and come to care for them as another person very well indeed, then this can be really tough. And straightforward bereavement and grief is part of how they are feeling. So we have been working with experts in our health service on trauma counselling, with Marie Curie, with Scottish Care and with COSLA, to look at what more we can do to provide additional mental health support for staff in community settings in social care, in addition to some of the mental health support that we've announced for our whole health and social care workforce in recent weeks. And I hope that as we go into next week, we will be able to say a great deal more about that. Some of it will be available because of the nature of where we are in the virus in terms of digital output or telephone counselling support output, but we will be looking to provide the most accessible and most relevant mental health support for people in what is a very difficult situation, and where they will have other anxieties, perhaps about their own health or their families or the situation that they're working in. So I hope that by the middle to the end of next week, we will be able to say a great deal more about the detail of the support that we will put in place for them.
Louise Scott from STV.
Good afternoon. We've spoken to a nurse who works at a hospital in Scotland on a ward with coronavirus patients, who says they are horrified to go on shift to be handed single-use PPE that has been worn by other nurses for 3 consecutive days. They are using hand sanitizer on paper towels to try and disinfect the equipment. They say other nurses have walked off the ward due to this. We've also heard of gowns being used at a separate hospital that Health Protection Scotland, in an email, say are not a suitable substitute. We've been giving reassurances for weeks that PPE is there or it is coming, but clearly in these instances, that's just not the case. The staff member says they feel they've been lied to. What's your response? How can you ensure these workers can receive PPE now?
Well, my immediate response to that is if you can put the member of staff in touch with us confidentially if need be, or provide us with the details of the hospital, we will go on to that straight away and try to resolve that. I would remind any health and care worker watching this, or if they have family members watching this, to pass on this information. We have set up a dedicated email address so people can email in if they don't have the PPE they need, or if they have concerns about that. That has been overseen by ministers, and again we will respond urgently. I and the Cabinet Secretary have always said, and I will say it again, we are working on a day-to-day basis. There's probably not an hour passes right now when the Cabinet Secretary and I don't talk about PPE, because this is so important. We will never stand up here and say it's fixed and there's no more work to be done. The nature of this, the constraints on supply that we're facing globally, the need to make sure that our distribution lines always work properly, the need to respond if a particular hospital or care home has a particular demand that they need replenished more quickly. So we will absolutely work to resolve all of these things and respond to any issues. So I would say to journalists, we're not in normal times right now, and journalists have the jobs to do, and I absolutely understand and respect that. But if people are contacting you like that, get in touch with us, tell us about it so that we don't have to wait to a lunchtime briefing to get on and fix it. We want to fix any of these issues that arise as quickly as possible, and we'll continue to be open about some of the challenges we're facing. We know that gowns globally are particularly pressured in terms of supply, so these are things we are working through and trying to resolve on a daily basis, indeed, as I said a moment ago, on an hourly basis. you want to add anything? Or?
The only thing I'd add to that, First Minister, is I am aware of the particular issue in terms of gowns. The gowns are satisfactory in certain clinical situations, but they have been issued to staff in other clinical situations where they are not the right equipment for that particular situation. We've gone through before the importance of different kinds of PPE depending on the clinical or social scenario or situation that you are delivering care in. Our National Procurement Service are well now on top of this, ensuring that the right gowns are issued for that situation, and the ones that are not appropriate are being removed and for use elsewhere, not the ones that have been worn, but the supply that is still there is appropriate in other situations, but are replacing those as we speak.
I have now Lindsay Hannah from Radio Clyde and Forth.
Thanks, First Minister. Can you provide us with an update on when NHS Louisa Jordan will open? And given that we've now seen the number of people in hospital and ICU recently, is it now less likely that it will be needed?
The NHS Louisa Jordan will be handed over formally to the NHS very soon, and I think more details around the opening of that will be given over the weekend or into the early part of next week, but it is on track. I had the opportunity to see it for myself a week ago today. We've always hoped that it wouldn't be used, but we want to have it there. We'll say more about this when it opens. We've always wanted to be in a position of not treating, if we didn't have to, the most critically ill patients there, although it will have ICU capability in case patients, if they are there, deteriorate while they are there. So we hope we don't have to use it. On the figures we're seeing right now, we certainly are in a position where we are not yet at the maximum of our hospital and ICU capacity, but we've got a long way to go in this virus, and it remains really important that we continue to plan and have the best possible contingencies in place, and that is what we will do. To add anything? Okay. Neil Puran from PA.
Thank you. The UK government has announced a review into why people from Black and ethnic minority communities are being some of the worst affected by coronavirus. Is this a phenomenon that we're seeing in Scotland, and is it something you're looking into?
I'll hand over to Gregor Smith, who will say a bit more about what we know from what we're seeing in Scotland, but also the sort of exploration that we will want to do into all of these issues.
So this is something which we have been following very closely. The UK 4 CMOs are in very close contact about a number of different clinical issues, almost on a nightly basis, but this is one that we've been keeping a very close eye on and trying to develop what evidence is there for any particular characteristics of person that would place them to be more at risk. Public Health England have done some initial work on this on behalf of CMO England, and as a result of that, it's become very difficult to actually determine what the data is telling us. So hence we've got this additional commission which has now been issued on behalf of the 4 UK CMOs to try to identify whether there is a real issue here or whether there is a culmination of factors which are acting together to produce the effects that we've seen in the system. So at the moment we don't have the evidence that we would want in this area, but we're working very hard with the other countries across the UK to make sure that we develop that evidence quickly.
Thank you. Vivian Aitken from The Record.
Good afternoon, First Minister. Just want to know, do we yet have any figures for the numbers of hospital-acquired COVID-19? And if we don't, when are we likely to get them?
I don't have those figures yet, but this is an issue of intense consideration and scrutiny. Gregor will be able to say a bit more about this, because we know, as well as community transmission, and obviously we've been talking a lot, understandably, about transmission in care homes, hospital nosocomial transmission is the other area that is being looked at really carefully, so that we understand more about that in order to inform even more intense infection prevention and control in hospitals. And there is some work underway to understand that in more depth, and Gregor can perhaps say more about it.
Again, this is an area internationally of real interest and some degree of concern. The experience across hospitals across the world has been that nosocomial infection or hospital-acquired infection has been a characteristic of this virus. I've said before that this virus loves to be in institutions, and we need to learn more about how it spreads within those institutions as well. So in the UK, we have a number of groups who are studying this just now. In Scotland, the Chief Nursing Officer has set up a Scottish group supported by my scientific advisory group to develop the evidence so that we can really get to the bottom of the truth as to what the data is telling us in terms of both the type of spread, how it spreads, and what we can do to make sure that we prevent that spread within hospitals as well. It's linked very closely to this UK scientific network that is examining this, and of course to the international network as well. And over the coming days and weeks, we expect to learn an awful lot more about this virus and actually how it behaves within these hospitals.
Thank you. Kristen Novell from Sun.
Hi, First Minister. How can we possibly be on track for 3,500 tests a day, given the number of those being tested has barely gone up since the start of April? Daily numbers have been below 1,300 for the past week, despite the current capacity being 1,900. And are you talking down testing and saying that it's not a panacea just to mask your own failings to put in place the required numbers?
No, absolutely not. With respect, you're mixing up two things, capacity for testing and the utilisation of that capacity. We are absolutely on track for 3,500 by the end of the month. In fact, I am very confident we will exceed that by the end of the month. The other challenge, and the Cabinet Secretary and CMO and I were involved in lengthy discussions about progress around this just last night. The other challenge is making sure we've got the throughput of people who need tested to make sure we're fully utilising that capacity. We are doing that, I think, much more effectively than we were previously around healthcare workers, and we are seeking to up that throughput of care workers and, where appropriate, their families, in order that we are fully utilising the capacity we've got. As we go into further stages of dealing with this virus, of course, that capacity will have to be built further, but that capacity becomes really important in terms of the test, trace, isolate approach that will become what we use in place of some of the restrictions that are in place right now to keep the virus suppressed and under control. So the capacity is absolutely on track, and that parallel strand of making sure that we are fully utilising that capacity is one that has real focus from us right now. Scott McNabb from The Scotsman.
First Minister, you talked about the economic advisory group that you've established today. I'm just wondering, has this crisis exposed the weaknesses in Scotland's economy? And what I'm getting at is the dearth of a manufacturing base. If you look at the likes of Germany, which still makes things, they've been much more effective, for example, at producing the testing kits, not been forced to rely on cheaper imports. Do we need to kind of reset Scotland's economy coming out the other side along these lines?
So in answer to your first point, I think my response would be no. I don't think this virus has demonstrated weaknesses in the Scottish economy any more than it has, or less than it has in any other country. This virus has thus far, and this will continue for some period, had a very serious negative impact on the economy because of what we are required to do to try to suppress the virus. But in terms of, I suppose, the other part of your question, will we come out of this crisis with the economy looking exactly the same as it did going into the crisis? Very possibly not, and perhaps nor should we want to. And that's not about saying that we are happy to see businesses fail. We are not. The scale of our intervention around this should say that. But this does give us, I don't like using the word opportunity when we're dealing with something so serious and so difficult. But this will give us in so many ways, in terms of the economy, in terms of how we deal with inequality, in terms of the climate, in terms of our own well-being. It gives us a chance to, as we rebuild and recover and repair, it gives us a chance to think about whether we want to do things differently. And I think that's an opportunity we should certainly take. And this advisory group, and we'll announce more next week about who will lead that, who will be on that, has got a key role to play in advising the government as we think through these things and take these decisions. My last point would be in terms of manufacturing. before this crisis and for some time, of course, we have had a real focus on building advanced manufacturing in our country. So we are in the process of establishing a national manufacturing institute in Renfrewshire, work that is well advanced to make sure that we are at the cutting edge of some of the modern techniques around manufacturing. And I think that work continues, and it will become even more important on the other side of this. Tom Martin from the Daily Express.
Good afternoon, First Minister. Reports this morning suggested a pilot scheme getting underway next week looking at Amazon-delivered home swab kits as a potential way out of lockdown. I just wondered, is there any involvement in that here, or are you exploring similar kind of things in the future?
We've been involved in these discussions UK-wide about the potential for home delivery of testing kits. Amazon has been in that discussion since the start of this outbreak. I know about the pilot scheme next week. We will be really interested to see how that goes. There has been, I think it's one of the areas, and this is not meant as a criticism of anybody or anything, but it's one of the areas that perhaps hasn't progressed as quickly as we might have thought it would have done at the outset of this. But anything we can do to make it, this is not about testing capacity, this is about making it easier for people to access tests. There are a number of things already in operation, like the drive-through centres, for example, but obviously with people who are, and remember, testing is most reliable when people are symptomatic, and when people are symptomatic, being able to do it in their own home, if that was possible, would be a step forward. There are other challenges around that in terms of whether the difficulty of taking the swab is something that would be effectively done at home, but these are things that if they can be worked through, then possibly this provides us with another tool in the toolbox to try to make sure we're using testing to the absolute maximum that we can. Simon Johnson from The Telegraph.
First Minister, on the figures published on Wednesday on death rates, I think we saw no deaths under the age of 15, thankfully, and only 8 under the age of 45. Is there a strong case for making the return of schools, in particular primary schools, one of the early stages in any unwinding of the lockdown, provided that the shielding of the vulnerable and grandparents continues?
I don't know the answer to that yet. I mean, as I said, we'll do this as openly as possible. We'll be assessing the different options, and schools is one of the closing schools is one of the measures that we introduced. So clearly, it is amongst many options about the measures that we could start to lift. So these will all be options that we look at and assess and try to work out what impact they would have. And these are going to be difficult balances, but I think it's really important that we share as much of this as we go, but resist the temptation, which is always there for a politician, to get ahead of what we know right now and start to speculate about things that are really not helpful as we're trying to work through this in an evidence-based way. So as I said many times over the last 24 hours, I want to do this as openly and as iteratively with the public as possible, which is why over the next week we will try to set out some of the principles on which this decision-making will be based. Rachel Watson from the Mail.
Thanks, First Minister. It's been revealed that UK ministers are looking at the feasibility and effectiveness of asking people to routinely wear masks to work and out in public. Sadiq Khan also has called for masks to be worn on public transport. Is this something that the Scottish Government is also looking at, and is it an area you would support exploring in order to ease lockdown measures?
Well, it's something that is already under exploration. I've got a lot of sympathy with Sadiq's position, and he has articulated that case publicly and has made that case privately within the decision-making processes as well. So I do have a lot of sympathy with it. I would hope we would issue some guidance over the coming days on what we are saying and perhaps also not saying to the public about the wearing of face coverings. And can I stress here, we're talking about face coverings, not medical grade face masks. We're waiting on some further scientific advice about this, and the reason I think it's important to do that is firstly that so that when we do give advice, we're not overstating what the protection might be that brings. I think there is some evidence, Gregor can say more about this, that face coverings may reduce your risk as a person of passing the virus on to other people, but how much it reduces that risk, I'm not sure there is certainty about, but that it doesn't necessarily reduce your risk of getting it. Now, that doesn't mean there's no value in it, but we want to be sure if we're advising people of something, we're not overstating what the protection might be and we're being frank with people. And the second point I would want to be clear about is that we don't give people false assurance around this, because it will not be the case that we are, certainly not in the imminent future, saying to people that the wearing of face coverings makes it safe for them to do things that we are currently telling them not to do. So the advice will still be to stay at home, and you know what all of the advice that I'm giving is. So I think it is our intention to put some guidance out on this, but I want to make sure we're giving the public good guidance that is informed by the science so that they understand the value and we get that value if there is a value, but we don't overstate it and give people a false assurance that might actually have a counterproductive effect. Do you want to add anything? Or?
It's very difficult to add anything to that, but I just wanted to kind of emphasise again, we need to make sure that we're guided by the science and the evidence here. And that these measures, if we were to go to recommending face coverings, then we need to make sure that we don't mistake that as being a substitute for some of the other measures which are very effective and in place just now. There are certain circumstances where there is certainly some interest in the evidence that is being produced around where they may be useful, but I don't think that it would be a kind of universal recommendation that we just wear these kind of face coverings at all times. So I would urge us to wait for the scientific review to complete, and then we can make a decision as to how best to go forward with that when that's available to us.
Mark McLaughlin from The Times.
Hi there, one for the Chief Medical Officer. I was wondering if you're looking at any particular countries when you're planning your lockdown strategy. We heard from Jason Leach on Tuesday. He was looking at the North Island of Japan, for example, remarkably similar population density to Scotland, but some important cultural differences, for example, wearing masks. Do you have any particular kind of favourite countries that you're looking at as you plan your exit strategy?
Perhaps won't surprise you that there's not one country that we're looking at, but many countries to see exactly what we can learn from a variety of different approaches. And my advisory group of scientists is currently examining the strategies that have been deployed across more than a kind of dozen different areas to see exactly what would be what the impacts that those strategies are having in those countries, but also whether they would be able and feasible to be applied within our own cultures as well in Scotland as well. So I think it would be wrong to give the impression that we're only looking at one country, but actually we're trying to learn from the international community in terms of what might work as we move towards the next phase.
Okay, Alistair Grant from The Herald.
Hi there, thanks very much. Can I just ask, and apologies if this has been brought up already, but I think you said on Wednesday that the Scottish Government hoped to publish the number of care homes with active or live cases of coronavirus. Is there any update on when that data will be published?
Yeah, we are hoping to do that within the next few days, small number of few days. We're just trying to, as some of this information that we're now publishing, we've not gathered in this form before. So some of the systems have to be put in place to gather it reliably, and we just have to make sure it is robust. But I want to publish as much information as possible. We are already publishing the cumulative number of care homes that have had an outbreak of coronavirus, and for obvious reasons we want to move as quickly as possible to be able to do that on a live real-time basis, so the number that right now are dealing with an outbreak. So that will be over a small number of days that we hope to be in a position to publish that information and thereafter publish it regularly. And lastly, I have Tom Magner from Carers World Radio.
The question picks up on an earlier, I'm not sure whether you caught the beginning of that, but thank you for taking this question, which picks up on an earlier briefing. How effective can the Scottish Government's distribution of PPE to unpaid carers in the home be when the UK Government advice says face masks, for example, are only important in a clinical setting?
I'll hand over to the Cabinet Secretary, who has talked previously about what we're doing now to try to make sure we get PPE to those in the unregulated care sector, unpaid carers and personal assistants.
I'm sure you know that to a degree there is a difficulty in finding a nice clean distribution route to that group of people, but they are very important and they do very important work, and we should do everything we can to make sure that they have the support and the personal protection that they need. So we have some excuse me, updated guidance about what is appropriate. It would be, as you'd expect, the apron, the gloves and the fluid resistant mask. We're still working through exactly how we can be sure that we A, understand the volume that would be needed, and B, get the distribution right. But we're getting closer to that every day. Undoubtedly, our local authorities will be a big assistance to us as a way of putting into a hub arrangement how people could collect that PPE. Our third sector organisations, many of our carer representative organisations also will be of great assistance to us. So I am hoping that over the next few days we will be able to tie down at least an initial approach there, accepting that there will then be glitches that will be revealed that we will have to fix as we go along, but at least to begin to get some of that important PPE out to that group of people.
Thank you very much indeed. That concludes the list of questions that we had notified today. Can I thank the journalists as always? Can I thank all of you for watching at home? The weekend briefing on Sunday will be led by the Health Secretary. I will see you back here on Monday. In the meantime, thank you again for complying with all of this advice. Please keep doing it and try and have as good a weekend as possible. Thank you very much.